Let's talk about the thoracic lymphatic duct, one of the largest lymphatic vessels, in fact, the largest lymphatic vessel in the body. It drains 75% of the body except for the right upper quadrant. Plays a crucial role in immunity and fluid regulation. It redistributes fresh lymph back into the bloodstream. Now, when we talk about the thoracic lymphatic duct, it's manipulated or it's stimulated by deep diaphragmatic breathing. The diaphragm, and now when we talk about the lymphatic system is just like the circulatory system. However, it does not have a pump. We know that the cardiovascular system has a pump, which is the heart. Now, the lymphatic system is affected indirectly. Now, with deep diaphragmatic breathing, we talk about the diaphragm. The diaphragm is like a pump and it creates negative pressure. And as we know, fluid moves naturally from a level of high concentration to low concentration. So deep diaphragmatic breathing is a key technique to help impact our lymph flow, particularly the thoracic lymphatic duct, which originates at the sternum, just slightly below the sternum, and then it comes into the chest and veers off to the left. So the technique we are going to be doing to help you support your immune system, support your lymphatic system, is deep diaphragmatic breathing. Deep diaphragmatic breathing is different from shallow breathing. Many of us are shallow breathers. What does that mean? On our inhalation, our chest elevates. On our exhalation, it digresses or it comes back to its original position. Deep diaphragmatic breathing is breathing from the stomach. So on our inhalation, we inflate our stomach. And on our exhalation, we deflate the stomach. The point of breathing is, of course, to bring fresh oxygen into our body. But again, that oxygen, we want to oxygenate the blood. When we breathe from our chest, we're utilizing our secondary muscles of respiration. And that provides us with a minimal amount of oxygenated blood. So we want to focus on breathing from our stomach, which is deep diaphragmatic breathing, right? So there's many components. There's the mechanical component, and the diaphragm is very interesting because where it's located in between the diaphragm and the spine is the vagus nerve. So as the diaphragm domes, it stimulates the vagus nerve, and the vagus nerve plays a key role in the central nervous system, the parasympathetic nervous system, bringing us from fight and flight to rest and digest. Now, as we're inhaling and using our primary muscle of respiration, we're also getting oxygenated blood, oxygen into the body, the optimal amount of oxygen, so that we can infuse our blood with oxygen. And also, as we're doing that, we're also stimulating the thoracic lymphatic duct. So there's several things that are going on just with this simple technique. So one of the things I always suggest to my clients is, first of all, let's take note of how we naturally breathe. So you put one hand on your chest, one hand on your stomach, and just take note. This could be in your bed. This could be after working out. This could be just in the car. Take a inventory of how you naturally breathe. Put one hand on your chest, one hand on your stomach, and breathe. See if your chest elevates or your stomach inflates. So that's the first thing, is we want to start creating the habit of breathing deep. So this also impacts our nervous system, calms the mind, brings us into a relaxation state. Let's get into the practical application of the power of deep diaphragmatic breathing. One of the things we want to establish is a habit. And we want to look within the mundane task of the day, and we want to assign deep diaphragmatic breathing to either our morning rituals, our breaks, or before bedtime. When establishing a new habit, we want to make it attainable. We want to associate it to a particular space so that our mind gets into the space, or we know that this is an actual environmental cue. So let's see, we're going to do this for 1 minute to start, to establish the habit. For those of us that are motivated and know that you can easily integrate this into your day, just go ahead. But for those of us that may have difficulties integrating this new technique or certain mindful self-care techniques into our schedule, we want to be practical and we want it to be attainable. We want it to be realistic. So first, let's just take 1 minute, whether it's in the morning, before we go to bed, or at some break within the day. Now we want to find a comfortable space to lie down, place our hands on our stomach, and you want to take a deep inhale through your nose, holding for 4 seconds when you get to the capacity or when your stomach is reached to its full capacity of inflating, and hold for 4 seconds. And on your exhalation, you want to exhale through your mouth, not through your nose, for 4 seconds. That completes one cycle, or one repetition of deep diaphragmatic breathing. We want to remember that you have, depending on where you are, how comfortable you are, we want to do a minimum of 8 repetitions of this breath and a maximum of 20. For those of us that want to deep dive and combine an Eastern approach called Qigong. In Qigong, Qi is breath, life force, practice of breath. If we want to amplify this effect, we can add this dynamic approach, adding some Qigong principles to our deep diaphragmatic breathing. So we want to put our tongue at the roof of our mouth and lightly close our mouth. On our inhalation, we inflate our stomach. On the exhalation, we're deflating the stomach, exhaling through our mouth, keeping the tongue at the roof of our mouth. And at the same time, there's this perineal area. It's between your genitalia and your rectum. You want to squeeze. It's almost like Kegel exercises. You want to squeeze that area on your exhalation. So there's polarities in our body. We have a positive pole, positive charge in our upper region, in our head, and then there's a lower charge in our genitalia, our pelvic region. So it's almost like we're connecting 2 circuits. When we put our tongue at the roof of our mouth, we're connecting the positive charge or the positive space with our perineal. So when we do the Kegel exercise, there's this connection of poles. So it may be a little bit complicated for those of us, but for those of us who are for those of us that are accustomed to deep diaphragmatic breathing already, this is something that you can challenge yourself to incorporate. So again, we're putting the tongue at the roof of our mouth to activate the upper positive charge. And on our exhalation, we're doing a Kegel exercise where we're squeezing the perineal area, which is in between the genitalia and the anus. You're doing a squeezing exercise as you exhale.